Hello, everyone. I'm Natalie Kunsman, MD, and particularly in the past week or so, I've really been treating and dealing with a lot of bad guts. So I thought we should probably recircle and discuss the topic of SIBO. So, what is SIBO? SIBO, small intestinal bowel overgrowth. So, the nuts and bolts really are the fact that the small bowel is not necessarily sterile, but it does not have a whole lot of bacteria. Most of our digestive bacteria are housed within the colon. So, when there has been a backflow or an overgrowth or too much of bacteria in the small bowel, this is where a lot of people can have a lot of problems. And it can be as simple or as complicated as you want. And as soon as we figured out different phylum of bacteria and different treatments and causative issues, we find out even more phyla and bacteria and fungus and parasites and treatments and a lot that goes on within that fluffy layer down at the microscopic level and even at our cellular, mitochondrial, ribosomal, and cellular level. Okay, so there are some risk factors that can make people at higher risk for small intestinal bowel overgrowth. And sometimes that is some of the changes in pH that we might be altering with some of our medications, which can alter which bacteria live and where. We also may have some difficulties with the MMC, which is how fast, or I should say the motor complex, which is how fast some of the food propels within our GI system. So obviously, if it is slow, as in a gastroparesis state, we can have a lot of bacteria that are just hovering in the wrong areas for a prolonged period of time. I've talked about the ileocecal valve before, and when that is faulty and the contents can't go from the small bowel into the colon through the valve, we can have a backlog because of a non-functional or hypofunctioning ileocecal valve. There is some intestinal dysbiosis such that we have the wrong amounts of bacteria in relationship to the fungal and parasitic organisms that commensally live there. And we can have a ratio problem or an overgrowth of certain conditions based upon our history of antibiotic treatment. The other thing that goes somewhat unrecognized, especially in the United States, is our poor food intake. So we have a lot of chemicals and pesticides and high gluten loads that can destroy some of the gut immune surface, and in that regard can cause some of the problems that we notice with SIBO and a dysregulation with our bacterial species. We have a lot of seed oils that create an excess of linoleic acid, and that can destroy our gut microbiome, as well as lack of activity and the fact that we Americans have a tendency to snack a lot. Now, when we are continually digesting, the MMC cannot regulate. So, in other words, that motor complex that keeps us propelling our food does better when we are fasting or in an intermittent fasting state. So, the timing of food ingestion can also be a problem. Constipation and chronic constipation and those conditions that may cause that will create a lot of the overgrowth, as it literally is not shedding in the process. SIBO can be treated, but first of all, you really should diagnose the problem. That occurs in the breath test, in which the patient may take a lactulose solution, and over a half hour, hour and a half, 2 hour, as the lactulose is processing through our gut system, the gut bacteria can release some of the hydrogen and methane. And if that is in higher proportions, that is indicative of an overgrowth. It could be also indicative of a dysbiosis. It does not tell you the very specific gut bacterias that you may have, and that may require stool testing down the road if you don't do well with your treatments. So, how do we treat SIBO? Well, in the functional arena, we have a lot of tools in our tool basket. Some of the treatment will certainly revolve around a better diet. And diet discussions and nutrition discussions are for another day. But some people's guts are so irritated and inflamed that they may have to go to an elemental diet. And we can get into elemental dieting in another video. So we have the dietary approach. We have the intermittent fasting approach to help with the MMC. We also have exercise that can help with the promotility. As in nearly every other condition, vigorous hydrating helps. And we also can help with the acid and the bile acid that should be in a decent proportion to manage this. We have herbal approaches. So there are some wonderful herbs that your naturopath or myself or other functional providers can help you with, which will have combination herbs that can be antimicrobial, so antibacterial, and antifungal. We also can use products that can help with some of the biofilms. And think of biofilm as almost like the pond scum type of environment that bacteria will use to wall themselves off so they can become impenetrable to treatment and set up shop in your gut. So we have the ability to work with some products that have that. We also have promotility agents that we may need for that purpose as well. Now, when all else is failing, this is where the medications come into play. So this is where xifaxan or fluconazole or neomycin might be required in addition to some of the herbal and natural approaches. But a lot of this requires a functional medicine provider that can really figure out the issues with your own self and your own medications and your own gut system to figure out what will work best for you. Now, notice I haven't yet really talked about probiotics. So probiotics, I think, are imperative when there is a dysbiotic system. But again, we're talking about overgrowth. So unless and until some of those other issues are taken care of that I mentioned, you can actually create more of a problem, because now you are adding more critters, more bacteria to the system, more prebiotic that may feed that system, and a ratio issue that could worsen the situation. So again, the probiotics work best in a dysbiotic system or in a reparative phase, or after the bowel has been treated appropriately with SIBO. Again, I am a functional physician, so I will always want to make sure that there is no Crohn's disease or colonic pathology or diverticulum or, God forbid, colon cancers or polyps or things like that that have not been ruled out long before we presume it is something in this arena. Again, they can occur concomitantly. We can work on SIBO while we are working on inflammatory bowel diseases and your autoimmunity. And I will also venture to say that some of the SIBO and the overgrowth and the gut-body connection, gut-brain connection, gut immunity connection can all be related and may even be foundationally the problem that is unlocking your autoimmunity or mast cells or histamine intolerance and so on. So again, SIBO, something that is very common in us Americans. We can consult together, we can figure out how to diagnose it, and how to treat it in your particular situation. I'm Natalie Kunsman, MD. Subscribe to my channel below, and until we meet again, be well.